welcome to everyone. A very, very warm afternoon to all of you, depending on where exactly you're joining us. My name is George Ndirango. We have quite an interesting conversation happening today. Finally, the forum is happening, the Future Africa Forum, in collaboration with the Pandemic Action Network. Thankfully or sadly, due to COVID, thankfully because we're still able to get this conversation across, but sadly we're not able to do it physically, of course, for more reasons than COVID, but we're here. Welcome to this virtual Africa Policy Forum on pandemic preparedness and resilience. So it's been convened by the two companies, the two organizations, the Future Africa Forum, whom we'll get to hear from at the top of this particular session, in collaboration with the Pandemic Action Network, whom we'll also get to hear from. We're privileged to have a diverse group of panelists and speakers who are here with us. Their cameras are off, but they'll turn them on in just a bit, and we'll be listening to them in the course of the call, and of course having a lot of discourse between them and anyone watching. So I'm pleased to inform all of you that Future Africa Forum and Pandemic Action Network, with the support of regional and national partners, have also developed something very interesting, a state of play report on pandemic preparedness and response. So that is available online, and you'll see a link of the same that will be posted in the chat box. But so let's look out exactly for that. Now, later on, we have a policy brief called An African Agenda for Pandemic Preparedness and Response. So it's been developed by the partner agencies and has had input from very different organizations all through. So when the time is right, we will get to see that particular policy brief, but not at the moment. Today, we'll have the opportunity to listen to key lessons from past epidemics and pandemics, and the key recommendations that are presented in that policy brief. And then we will launch the policy brief before the conclusion of the forum today. And then the link will be available for download also in the chat box. So we have two things. One is the state of play report, and two is the policy brief called An African Agenda for Pandemic Preparedness and Response. I'm also happy to note that the Africa Policy Forum on Preparedness and Resilience gives us the opportunity to look back and reflect on the theme of Africa's pandemic preparedness. We know exactly what happened 2 years ago and what we're facing now, how exactly the continent rallied to make sure that we beat COVID, and how we were, what kind of approach we did towards each other and as countries and as a region, a collaborative approach to building a more resilient health security architecture that can now effectively respond to pandemics. So if another pandemic does creep up, of course, in worst case scenario, another pandemic creeps up soon, we'll definitely do a lot better than we did a few years ago. So in view of the above, I've mentioned the two things. Presentation of the policy brief will happen. A link will be available for you to download. There will be a panel discussion on enhancing Africa's pandemic preparedness and response ecosystem. We will have a fireside chat on, even as we discuss all these things, who exactly finances it. And then we'll have a Q&A session, of course, with a CDC representative who will react to what has been discussed by panelists, as well as giving more insight from the Africa CDC and their work in pandemic preparedness and responses. Now, since all that is very clear, or seemingly very clear, let's get into the meat of today. We're privileged at the beginning to kick things off very quickly with two people. Gerald Chirinda is the founder and CEO of the Future Africa Forum. He's also the founder and CEO of Future Africa Investments Limited, a company that focuses on building sustainable enterprises and unlocking real value on the African continent. So as founder of Future Africa Forum that has convened us here today, he engages leaders and governments to advance Africa's prosperity, and we'll get to hear him as well. We also have Caroline Reynolds, who's a global health and development advocate and co-founder of Pandemic Action, who will also give us their perspective on what exactly we'll be hearing today and what we anticipate will be the outcome of this forum. So let's get that going. Gerald, over to you.
Thank you so much, Georgie. Ladies and gentlemen, distinguished guests, all protocol observed. On behalf of Future Africa Forum, allow me to begin by expressing my most profound gratitude to the Pandemic Action Network for working hand in hand with us to organize this event. Future Africa Forum is a platform for thought leadership that consults with organizations which are building a better Africa. We bring together the greatest African thinkers to research, implement, and amplify bold ideas and solutions to create tangible and sustainable change across the continent. With that in mind, we are grateful to all speakers and the audience members for making time to come and have these critical conversations regarding preparedness. Your presence is a reinforcement of the fact that Africa is ripe for a new direction and autonomy regarding our health preparedness. As you might be aware, the ongoing pandemic has been a wake-up call for Africa on the urgent need to build resilient public health systems and strengthen continental health security. The Africa CDC is championing this effort and has called for a new public health order for Africa. This is an independent and sustainable move towards continental health security. This comes in the backdrop of the demonstrated inequity in global health systems and the dependence of African countries on external support. Whereas most countries in the global north have managed to fully vaccinate 70% of their population, just over 15% of the African population has been fully vaccinated. With that being said, we have worked on a policy document that many of you will have access to. It highlights the above issues and recommends possible solutions going forward. We have also worked on a state of play report, which provides a summary of the latest developments in policies and interventions for African pandemic preparedness and response. Our conversations today will be based on the contents of these two documents. Ladies and gentlemen, this event gives us as Africans the opportunity to chart our way forward, banking on the knowledge and expertise we possess. We hope to galvanize government, social, and private sector support in ensuring that we not only have these critical conversations, but we also create a roadmap that contributes in the journey towards pandemic preparedness and resilience. Our hope for today is that we will have meaningful conversation that will help set the stage for policy development in the African health sector. But most importantly, will imprint the importance of pandemic preparedness in our minds, thus spurring you into immediate action in your areas of influence. Thank you, ladies and gentlemen. I wish all of us a fruitful deliberation. Caroline, over to you.
Thank you, Gerald, and delighted to be here. I just really want to thank all of you, first of all, for joining us today for this Policy Forum on African Preparedness and Resilience. And I'm so pleased to partner with the Future Africa Forum on this important initiative. The Pandemic Action Network, if you don't know who we are, we're a partnership of more than 250 organizations around the world that are focused on driving collective action to end this pandemic and to prevent the next one. And we're really committed to stay in this fight. This is why we are here, and do whatever it takes to mobilize the political will and the sustainable financing that's necessary to pandemic-proof the world. A growing number, I'm really pleased that a growing number of our partners are African, including the Africa CDC, which was one of our founding partners. And we have an active Africa Regional Working Group with more than 30 participating organizations so far. So if you're not already in our network and you're, we really hope that you'll consider joining us after today's forum. Please visit us at pandemicactionnetwork.org, or you can be in touch with my colleague, Nahashan Alawoka, our regional advisor, who's here with me today, and Nahashan can share his contacts. As Gerald alluded to, this pandemic has really underscored the challenges as well as the opportunities that we see around the world, and particularly in Africa when it comes to pandemic preparedness and response. On the challenges side, COVID-19 absolutely has exposed the tremendous inequities in global access to life-saving tools, including vaccines, diagnostics, therapeutics, PPE, oxygen, in addition to the tremendous loss of lives and livelihoods. The pandemic has also caused major disruptions in delivery of essential health services, in some cases more than 25%, and to reversals in health outcomes and poverty reductions for the first time in 2 decades in many cases. But there are opportunities, and that's why we're here today. We've seen incredible strength and resilience by communities, commitment to innovations by frontline health workers to adapt in the face of this pandemic and continue to serve their communities. We've also seen really strong regional cooperation and collaboration across the African Union member states, including, for example, through the AU Regional COVID Response Plan, the creation of the African Medical Supplies Platform, the African Vaccination Acquisition Team, the African Regional Manufacturing Initiative, and more. And I really want to, before we get started today, applaud the efforts of our partners and colleagues in the African Union and the African CDC for really forward-looking thinking to strengthen the continent's preparedness for future health threats through decisions such as the recent decision at the AU Leaders Summit to set up the African Pandemic Preparedness Authority, transitioning Africa's CDC from a specialized technical institution to a public health agency with this broader independent mandate, and also the calls for a new public health order for Africa and for a regional epidemic fund. This is the kind of forward-leaning leadership and solidarity that we need regionally and globally to treat pandemics as the collective and systemic risk that they are. So as Gerald said today, we're really pleased, Future African Forum and Pandemic Action Network, to share the recommendations which we'll talk about today in our policy brief and in our State of Africa report. We'll talk about this, so I won't preview them all now. They range from financing to governance to stronger institutions and governance and a strong health workforce. In particular, I do want to call attention to one of the recommendations that you'll see, which is to mobilize political and financial support around a proposed new fund for global health security and pandemic preparedness. The purpose of this new fund is to mobilize and direct resources toward the gaps that have been identified at national and regional preparedness, and to support countries in developing and implementing their national health security action plans. Many countries had started on this work before COVID. The need is ever so much greater in the face of this pandemic, and drives home how much there has been just chronic investment in preparedness at all levels. So, and implementing the ideas and plans for the new public health order in Africa, all of the recommendations that we'll talk about today in our policy brief require substantial additional commitments of financing, both domestically and internationally. So that means more national budgets committed to work on health overall, and it's specifically capacities for preparedness, commitments at the regional level to cooperate on ensuring that people have the access to the tools they need in the face of a pandemic, and international partnerships. Look, pandemics are cross-border. They're something that every individual country has to be prepared, but no country can do that in isolation. And investments in preparedness are ones that benefit all of us, no matter where we live. And so they are things that need international as well as domestic support. Everyone needs to have skin in the game, whether you're both governments and private sector organizations and communities. And we see this global effort really working closely in tandem with the Africa regional efforts and the proposal for a regional fund. So, and I'm really pleased to say that this idea was endorsed last week by the G20 member countries, including South Africa, which has been a leading champion. And I really urge other governments and non-governmental organizations who are on this forum today to follow suit. Finally, I just want to say on behalf of my colleagues at the Pandemic Action Network, we really hope today's forum will yield more ideas. We've set the table for this discussion, but we are looking forward to your ideas, your experience, your evidence, and mostly your inspiration to inform our work. And we want everyone here to leave today with their commitment to stay in this fight. As Gerald said, no matter where you are, whatever your sphere of influence, we really need all of you to help ensure that such a deadly, costly pandemic never happens again. Thank you, and best wishes for a great discussion today. Over to you, Georgie.
Right, thank you very much, Caroline. Thank you very much, Gerald. I think now we're on the same page and we are off to a great start. So let's move on to the second part of the session today. Let's hear a bit more about the content and recommendations of the brief that we touched on at the top. We have two fantastic people to guide us through that. One is Muna Ngenda, is a Future Africa Fellow. Muna is a Future Africa Fellow with expertise in the political economy of development and cross-sectoral policy initiatives. Muna also coordinated the Future Africa Forum's recent work on COVID-19 recovery. A bit has been touched on, but we'll get to hear the breadth of it, and previously led policy-focused consulting teams at Dalberg Advisors. Muna also holds an MSc in African Development from the London School of Economics and Political Science, an MA in Economics from Temple University, a Mo Ibrahim Doctoral Scholar in the Politics Department at SOAS, University of London. The accolades are so many. Coupling with Muna will be Dr. Maggie Walker, who is a Future Africa Forum Research Fellow with expertise in public health research, project management, and policy engagement. Just like Muna, Dr. Maggie also has a barrage of accolades, a Boston University Rockefeller Foundation 3D Fellow working on social determinants of health research, holds an CHB from University of Nairobi, MSc in Global Health from University of Barcelona, Public Policy Certificate from London School of Economics, has been recognized as a distinguished young woman leader. By the time we finish the accolades for Muna and Dr. Maggie, we'll be at 4 p.m. East African time. So let's just throw straight to Maggie. Maggie, maybe how about you start us off with an overview of the path ahead?
Thank you so much, Georgie, and thanks for that great introduction. So the path ahead, we're really at a fundamental moment to discuss the path ahead when it comes to pandemic preparedness and response in the region. And this policy brief essentially highlights and maps out critical steps that we need to be able to take in terms of recognizing where we currently are and where we are planning to go towards having a more resilient and more inclusive regional policy architecture. And to state, the policy brief is actually based off of the State of Play report that has been highlighted by Gerald, which looked at various national and regional policy documents dealing with pandemic preparedness and response, really get a sense of where are we, what are the concerns and aspirations of policymakers, and what are the pressing challenges now, and also what are the emerging solutions that are currently in play in the region. So to just start us off, as we think of the path ahead, this quote comes to play from Dr. John, the director of the Africa CDC. And essentially what it highlights is the need for urgency to act now, because it's not a matter of if the next pandemic is going to hit us, it's a matter of when the next pandemic will hit us. And that brings us to COVID-19. So just next slide. So COVID-19 has definitely devastated our social, economic, and political fabric of society. But I think what it has truly brought out is it's a moment of reflection. So it's allowed us to sort of take a step back and reflect and take stock of where we are as a region in terms of being able to address issues on emergency preparedness and response systems. It has magnified the flaws in global equity and solidarity. We all saw how underserved Africa as a region has been by global coordinating bodies. We've seen export bans on reagents, we've seen vaccine hoarding, we've seen nationalism, and all which has just been a wake-up call for the region in terms of, okay, we need to put our ducks in order, if I can put it that way. It's also highlighted the overdependence of the region in terms of external support, whether be it financially or in terms of resources. And so really looking forward, we really wanted to have this as a basis of where we are and highlight now what are the lessons we've been able to learn from COVID-19 moving forward.
Yeah, I'm particularly curious about that. So the brief definitely leverage on the lessons demonstrated, but it's not COVID specific. It's also Ebola and the recent outbreaks and the significant experience in that and the innovation around it. Maybe you could just go deep into a sense of some of these. Huh?
Correct. And that's perfectly in line with what I'm about to just share next. So we have faced several outbreaks and several epidemics in the region. You mentioned rightly Ebola. We have Lassa fever, cholera. I mean, it's endless how much we've been able to face. And what strikes us as we were doing this research, what is striking is that lessons learned have been documented. We know where the gaps are, and those gaps have been clearly highlighted. However, what the issue has been is, are we turning those intentions into actions? Because an experience learned doesn't necessarily mean that without concerted effort to actually change it, then we will just be in a talk shop, if I can put it that way. So one of the key lessons learned is, can we be able to seize the momentum now that we're able to recognize the challenges that we're facing to be able to turn intentions into action? Then the second lesson that we drew out from the research that we did is health workers. And that has been mentioned by the opening speakers in terms of how important we need to invest towards a very strong public health workforce. I mean, health workers were the backbone, or are the backbone, if I can put that, of effective responses. However, we've seen challenges in terms of the coordination aspect of it, how they're being compensated, the level of training and institutions to be able to provide them that support. And in addition to that, it's not just support in terms of the tools of trade. So thinking about training, the protective equipment, but also in terms of their health and well-being, where we saw the safety, both mentally and physical safety of health workers being put into jeopardy as a result of the lack of systems in place to be able to support them well. Money is always money is always a challenge, and one of the key, there's a quote by the Independent Panel on Pandemic Preparedness that says, governance without finance lacks teeth, and finance without governance lacks accountability. And one of the key things we noted is, as we're looking at the previous pandemics and epidemics or outbreaks in Africa, you find that during the outbreak or during the pandemic, you see a very high rise in terms of funding that goes in. So you see all these specialized emergency funds being put into action. However, after the pandemic or the outbreaks now start waning away, then you realize there's a reduction in terms of funding. And that's when we should actually be upping the investment levels, whether it's on research and development, the recovery process, post-pandemic, post-outbreak. So sustainability has been a very key aspect in terms of making sure that it's not just at the moment, but it's consistent throughout. I'm sure most people, I can see almost 90 participants, and I'm sure most of you have had the vaccine. You've probably been tested for COVID-19, and all that is as a result of research and development and the investments that were put into research and development. However, one of the key gaps that was noted is in terms of the research and development within the region. So 70 to 90% of medicines in Africa are imported. And we also saw the challenges with the vaccine hoarding and vaccine inequity, like Gerald had mentioned. So it really was a key lesson here was that we need to be able to build an Africa-led and owned consensus in terms of what the top priorities for research and development are, key partnerships, and increase funding for us to be able to be the manufacturers of those tests, those vaccines, and those treatments. And now finally, one of the lessons that we wanted to highlight is in terms of proactive procurement. So pandemics are not just about the clinical care, so about the treatments, the vaccines, but it's also about coordination, it's about logistics, it's about communication. And we saw that when we saw the gaps in terms of local supply chains, where even if sometimes vaccines do get into a country, the level at which it's being able to be distributed to get to the right people we've seen challenges in terms of that. Now, what this tells us is that we need stronger guidelines for supply chain and management systems, and we need to also be able to build better infrastructure. The beauty is we're already seeing concerted efforts to be able to address some of these lessons learned, and Muna will definitely be able to now highlight how we can be able to move these lessons learned to hopefully practicable actions. Thanks.
Perfect, thank you. Thank you so much, Maggie. We would like to change over now to the recommendations. I'll introduce Muna in just a second, but there are over 100 people in this session right now. We're seeing some tweets coming in. At Future Africa Forum is the handle. If you'd like to tweet, at Future Afri Forum is the handle, or you can use the hashtag Africa Pandemic Resilience. So just make sure to tweet as much as possible, tag the organization as much as possible. Just give what you think are your highlights. And of course, we've seen some of your comments coming in. Mabel has said thank you. David has said his name. Nahashan has given his email. So we need that conversation to keep going. For all of you that have questions, we will be able to ask Dr. Maggie and Muna right after Muna speaks. So please write as many questions as you'd like within the Q&A or the chat box, and then we will ask them immediately after this. So Muna Ngenda is also a fellow at Future Africa Forum. He's here to give us a summary of the actions advocated in the brief. Muna, what are the headline items we're looking at?
Thanks, Georgie. So the first thing to know about the recommendations is that they're all aligned to the recent call for a new public health order for Africa, which of course emphasizes 5 areas for urgent change. So you'll see that the recommendations align to those 5 areas, and I'll take you through them quickly. And the second thing is that these recommendations, they call for specific actions from African policymakers, from their global partners, and also from regional health actors to first make sure African health systems are high functioning in general, and then to also make sure that they are less strained by emergency situations. So the 5 areas quickly. The first is in establishing and connecting national public health institutions, because NPHIs are an important element of continental pandemic preparedness and response governance. So what we're calling for is for the countries that haven't established national public health institutions to establish them, and to take advantage of the guidelines that are out there, put out by the Africa CDC, by the WHO, by the Center for Disease Control. And where there are existing public health institutions, we're calling for additional funding to strengthen their operations, especially in terms of laboratory and research capacity, and to better interconnect them to be able to collaborate across the continent. A second area is in regional manufacturing of medicines and medical supplies in general. Maggie alluded to, the continent's dependence on external support. And so actions that we see that can really be taken to accelerate regional manufacturing, on the one side is the investment in hard infrastructure, in partnering with private industry on joint vehicles to be able to actually invest in production plants. But on the other side is the regulatory environment to enable the production and the movement of this equipment and these medical supplies across the continent. Thirdly is strengthening the public health workforce. And so the brief calls for attention to the working conditions of public health workers. So these are issues of training, compensation, enough equipment, and doing this across tiers of public health workers, but with a special call out to community health workers who are often the most underappreciated, under-resourced, and underutilized public health workers. The fourth area is addressing inequities in global partnerships. And this really gets to the spirit of the call for a new public health order. And so the changes we would like to see here is greater African participation in global research and development, greater African representation in global decision-making, and a shift in the nature of partnerships more towards global solidarity and away from the nationalistic competition that we unfortunately observed with COVID. A last area is empowering regional bodies for pandemic governance. And so this is speaking to institutions like the Africa CDC, supporting its rapid transition to a public health agency, supporting the rapid rollout of the African Medicines Agency, supporting the practical implementation and acceleration of trade under the African Continental Free Trade Area. And funding, of course, is a major issue in all of these rollouts. So we would again reiterate Carolyn's call that global leaders support the proposal for a global health security fund. And funds like that can be a great catalyst for moving funding from national grants, national loans, national projects to regional collaborative projects, financing regional projects. And so a common thread running through all of these recommendations really is that there needs to be global cooperation, and there needs to be the political will and the funding behind it. So in terms of political will and funding domestically, we would like to urge African leaders to honor the Abuja Declaration for increased health budget allocations to health, and then generally just urge all the relevant health actors to seize the urgency created by COVID, seize the momentum created by recent African Union actors, and let's just ensure that we're better prepared to prevent or respond to the next pandemic. Thanks, Georgie.
Perfect. Before you go, Muna, there's a question. I would like to turn the attention now to our audience, the people watching and listening in. If any of you has a question, please just write it in the chat. We have 2 that have come in, so we'll pick those up. But if you have any, we have just about 5 minutes. So we'll go through the questions now. And the first question has come to you, Muna, from a gentleman called Charles Kamau. On regional manufacturing of medical supplies, what would be your direct recommendation to regional economic blocks? You've alluded to bits of it, but what's your direct recommendation?
So I think one thing is ensuring that products can move across borders, because it's all very well to situate a plant in one country, say a regional leader like Kenya for East Africa, but then you want to be able to make sure that, so in this Kenya example, that those products, the regulations, the standards, the guidelines within the EAC are harmonized to move those products within the EAC. But then also, how does the EAC work with other regions like SADC to make sure that products are not only moving within the region, which is of course, it's a first prize to be able to move things within the region, but the broader goal has to be able to move them across the continent as a whole.
I hope that answers Charles. So perfect, Mona. There's another question to you, but let's jump to another one first. Dr. Maggie, there's one question that has come that says, COVID has certainly exposed what most of us already knew in terms of inequality, right? And we've always been saying inequalities keep broadening. Do you think the momentum will stay to establish the new public health order in Africa, or will it fade away until the next pandemic? We saw that with Ebola, so that's a very valid question.
Very valid question. And I think that's Christine. Yes, it's Christine, I think, who mentioned it. I mean, it's a valid concern, and I think it's a risk as well. And that's why one of the key areas we were highlighting in terms of the lessons learned was, are we going to seize the momentum? And I think that's why this conversation, the conversation that we're having right now, in terms of making sure that we don't go back to repeat the mistakes of the past, because that would be a disservice to ourselves. So towards Christine's response, I do think, based off of the previous experience, we are actually moving towards a better place. And you can even tell based off of the several initiatives that have been formed, whether dealing with manufacturing, in terms of improvement of health workforce, strengthening research institutions within the region. So I would say that as much as it's a risk, that we are actually seeing the momentum towards making sure we don't get back to where we were before.
Perfect. You've mentioned manufacturing, and there's a question also from Christian to Muna that came in. How advanced has Africa CDC gone with establishing regional manufacturing? Regional is a crucial point because a lot of people are thinking about national manufacturing, where they want individual countries to set up manufacturing facilities, but this might be entirely costly and ineffective in the long run. So let's speak about that. How advanced has Africa CDC gone with that regional manufacturing space?
Right. So I think this, first of all, a question of, where the mandate sits for the actual production. So where Africa CDC may not be directly involved in production, of course, they do have a role in, regulation, in standards, and in supporting that production. So I think when we say how far have we gone with production, I think the question there is a little bit more on private industry and to what extent they've been supported, both by national and regional regulators. So we do allude to some examples and some case studies in our research, both in the brief and in the state of play report, of some really encouraging examples where the public sector can take a lead, can partner, whether that's partnering in terms of financing or whether that's partnering in terms of establishing the kind of vehicles that can invest in production. I think there is progress. I'm just not sure we'd say how far has Africa's CDC gone. I'd say they support it, but actually establishing production, I think, sits with the regional private industry.
Yeah, that's very, very true. It's not a one-person job. It's not a one-man job for sure. Mabel has asked a question on the second recommendation. Their work, Mabel mentions their work through the Nelson Mandela School. UCT has identified challenges with infrastructure development. So infrastructure development that supports manufacturing, they've identified challenges within that. And of course, the need to create a supply chain of emerging talent from higher education institutions to build forward. So building capacity, building technical resources. Do you have any additional points on this, either Dr. Maggie or Muna?
Okay, thanks, Mabel. So I'll just take a shot at this question. So in terms of infrastructure development, you're correct. And that's what we've highlighted, that yes, there are gaps in terms of, and I'll focus specifically on the emerging talent, because when we're talking about building a public health workforce, one of the key areas we're discussing is not just doctors or nurses. We're also discussing around epidemiologists. We're talking about researchers, and we noted that has been a gap within the African region. And that's essentially one of the key reasons is, one, the institutions don't have the quality or to be able to produce this kind of talent, or they do have the quality to produce this kinds of talent, but it's the retention. So we have these amazing people who are graduating all the time, but can we be able to sustain them and to retain them within the system? So I do think that's definitely a valid concern. And one of the things that has been noted within the African region over the last few even in the last 2 years, I'd say, even as COVID-19 came in, is the need to be able to now start reprioritizing research and development to be able to now be very Africa-led and to also have Africa drive that agenda. Because I think that's where the gap is who is deciding what those priorities are, and how are we able to build infrastructure that is contextual to the needs of our region. So I don't know if that answers the question, but yes.
It does. It definitely does. So we'll take 2 minutes. I know we're running quick on, we're running just a bit tight on time. We'll take 2 questions, and then I'll ask Dr. Ebere actually is here, and Dr. Ebere co-leads Africa's CDC's Partnership for African Vaccine Manufacturing. So we'll just give him 1 minute because I know some of the questions are in regards to manufacturing. But before that, just 2 minutes. One, do you think, that's to you, Muna, do you think African countries have the potential to independently finance the response to the pandemic without relying on external aid? You knew this question would come.
And I'll default to the Abuja Declaration. I think if we get to a point where as national actors, as countries, as nations, we are allocating 15% of our national budgets to healthcare, I think a lot of these questions around funding in many different areas don't fall away completely, but become less pressing. So I would say that. I'd say let's rally behind the Abuja Declaration. Let's push our national leaders to honor that declaration. And then I think some of these regional funding questions become a little bit easier.
Absolutely perfect. Muna and Dr. Maggie, I really can't thank you enough. Before you go, let's hear from Dr. Ebere, of course, who's right there, just 1 minute. Dr. Ebere, yes, so the manufacturing question, and of course, there's one tied to that, your thoughts on patent on products needed in Africa, and then we'll go to the next part of the session.
Great, thank you very much, and it's a pleasure to join you, and thanks for the very important questions about manufacturing. I thought it was important to come in to clarify what the role of Africa CDC is here around manufacturing pharmaceuticals in the broader sense, but particularly with the Partnership for African Vaccine Manufacturing for vaccines. So Africa CDC is a public health decision, so not a manufacturer. What it's doing through the PAVM is helping to create an enabling environment so that manufacturing can be developed successfully and focus on our priorities as a continent. So the PAVM has established a continental strategy indicating which vaccines we should prioritize beyond COVID, indicating what areas of the technological spectrum we should be investing in. So looking at not just everybody going to mRNA, but looking at the entire spectrum, looking at what systems we need to ensure that an industry is sustainable and viable. That means looking at the regulatory authorities to make sure that the quality is recognized, making sure that there is development of research and development and talent, workforce that's going to need to drive this ecosystem, and also importantly looking at the market and ensuring that there is actually a mechanism for ensuring that manufacturers get their products to the countries they want, to the people who need the vaccine. Prioritizing Africa, but also, of course, we have no intentions of limiting any manufacturer from exporting in due course. But the focus of this is ensuring that we have access to vaccines for our own health security. So by focusing on the enabling environment, we encourage countries, private sector, public sector, to then work together to establish the manufacturing systems that we're already beginning to see emerge, and continue to encourage them and provide the architecture and the infrastructure to ensure that their products get to market. And Dr. Sidibe, who's on the panel with us, is leading the African Medicines Agency, which will take on the broader regulatory responsibilities for pharmaceuticals. And we see that some of what PAVM is doing for vaccines will subsequently move under AMA's jurisdiction over time. So we're not manufacturing, we're creating the system to support manufacturers, and most importantly, through gathering information and analysis of the market, steering interested manufacturers to where they can optimize impact.
Absolutely perfect, Dr. Ebere. Please don't give up most that we're going to discuss within our panel. Let's save some of it for that. But Mona and Dr. Maggie, thank you very much for your time. We definitely do appreciate that. Dr. Ebere, we'll see you in just a few minutes. Huh?
Thank you.
All right. Let's quickly change over and hear some special remarks. Coming up next is Dr. Abraka, Dr. Fiona Abraka, who's the team lead for emergency operations at the World Health Organization. Dr. Fiona has worked for WHO for the past 18 years, supporting countries, including her native country, Uganda, Ethiopia, and Nigeria, to build capacity to deliver vaccines. She's now applying her vast experience in polio eradication and broader immunization to support the continent's fight against disease outbreak emergencies and humanitarian crises. So it's only fair that we hear the special remarks from Dr. Fiona. Doctor, over to you.
Thank you so much, George. I'd like to thank colleagues at the Future Africa Forum and the Pandemic Action Network for convening this exciting strategic policy forum to elevate pandemic preparedness and resilience efforts on the African continent. I'm taking the opportunity to provide some remarks on behalf of the WHO Regional Director for Africa, Dr. Matsidisho Moweti, who's unfortunately unable to join this afternoon. It's exciting to hear our alignment as stakeholders on this important topic, and I will share her remarks with you. As you know, public health threats arising from a pandemic or epidemic-prone diseases and humanitarian crisis continue to be a major concern for member states in Africa, and these emergencies threaten national, regional, and global health security. Health systems in Africa over the last 2 years struggled to contend with the unprecedented shocks arising from the COVID-19 pandemic, even as actual numbers in the region remained far below what the original projections had been at the start of the pandemic. Experience from the pandemic and from past epidemics show that disruptions in health systems result in a significant number of direct and indirect deaths. Although many health programs suffered considerable drawbacks and virtual paralysis during the span of the pandemic, at the end of 2020, countries started to resume and scale up health services. On the continent, many countries deal with multiple concurrent public health events at the same time. For instance, while fighting the COVID-19 pandemic, Guinea responded to an outbreak of Marburg. The Democratic Republic of Congo has been responding to Ebola, including an ongoing outbreak that was declared 3 days ago in the Equator province. And there are ongoing outbreaks of yellow fever and cholera in several countries in the region, and humanitarian crisis in a number of countries. This COVID crisis is a wake-up call to the importance of repositioning preparedness as an integral aspect of strengthening health systems and advancing national development and security agendas. Taking lessons from other global health crises, we are pleased to see ministries of health across Africa have understood the need to strengthen all pillars of the health system to maintain and enhance service continuity. Countries have massively ramped up public health capacities, and health system capacities to manage cases have also improved. However, the continent faces multiple health risks and threats, including risks associated with rapid population growth, increased population movement across the continent and the world, existing endemic diseases related to poverty, emerging infectious pathogens, and the ascendance of antimicrobial resistance, threats posed by environmental toxins and natural disasters, and intentional biological threats. Acknowledging that weak health systems provide fertile ground for the growth and spread of dangerous pathogens, it's important to establish an effective health security system that's resilient and adaptive with a clearly defined public health coordination mechanism. Empirical studies have shown that national public health institutes or other equivalent bodies are better placed to enhance this effective health security system. The public health institutes are good at coordinating public health functions within and across countries, addressing health challenges and coordinating the response to challenges by working in partnership with a broad range of stakeholders. Member states in the region began establishing public health emergency operations centers to improve response coordination capacities, particularly after the Ebola virus outbreak in West Africa during 2014 to 2016. WHO and key partners on this forum, Africa CDC, the Gates Foundation, and others have assisted member states in establishing and strengthening their public health emergency operations centers, usually housed within the National Public Health Institutes. And we've done this by providing tools, guidelines, and standards, establishing and equipping public health EOC facilities, capacitating the health emergency management workforce by providing training on emergency management and conducting simulation exercises to test different capabilities. These public health EOCs serve as a hub for effective coordination, communication, and availability of real-time and quality information for evidence-based decision-making. And they bring together multidisciplinary and multi-sectoral experts to coordinate response in a structured manner. In 2015, WHO Regional Office for Africa launched a regional emergency operations center network to lead and support this effort. We are pleased to note that to date, the African region, WHO African region, has 26 countries with national public health institutes. 36 member states have established public health emergency operations centers at national level, and 17 have established emergency operations centers at the sub-national level. These public health institutes are also enhancing life-saving research on priority health problems in Africa, and they serve as a platform to share information and knowledge besides conducting high priority public health research. There is need in the region for a significant investment in a strong public health workforce with diverse skills and expertise to ensure health security on the continent. For instance, it's estimated that the continent needs 25,000 frontline epidemiologists, but has only trained about 5,000 as shown from empirical research. A skilled public health workforce will need to be underpinned by strong institutions with the ability to attract and to retain skilled health workers. Additionally, more is needed to provide the networking and the infrastructure for experts to apply their talents for maximum impact. African governments therefore need to bolster investment in research and development, innovation, and manufacturing of health tools. This would underpin a strong public health institution that is fundamental to creating resilient health systems. Africa must also prioritize training the next generation of global health leaders to embrace a multidimensional approach to solving health challenges and understand that public health agenda must be pushed politically and diplomatically. We see public health institutions as well placed to support the positioning of the next generation of leaders who can elevate public health causes at the political level. We are therefore strongly encouraging support to member states that have not yet set up national public health institutes to accelerate their establishment as part of preparedness efforts. Effective and trusting partnerships between governments, the private sector, researchers, policymakers, and development partners whose efforts are aligned toward the goal will be most critical. On behalf of the WHO Regional Director for Africa, Dr. Moweti, I once again thank you for this opportunity and look forward to the continued productive discussion that's already underway. Thank you.
Thank you. Thank you very, very much, Dr. Fiona. We really appreciate it. A lot of people are saying, you know, what's very well said, we need to prioritize research and development in the African continent. So we'll definitely get to hear a lot more feedback on what you said, and we appreciate giving us context even for our next discussion. Now, we're about to jump into a panel discussion that will take just a bit longer than the sessions that we've had before, but we'd like to remind you two things. One, most of the questions that you're sending, we'll take them in order of as they come. So when they come in, we'll ask, when it's time for the Q&A, we'll ask the question depending on who was the first to ask. So we encourage you, as you hear the speakers talk over the next couple of minutes, please just put your question in the chat and I will pick it in the order in which it comes. So unfortunately, because of time, we were not able to pick all of your questions for the previous session to Muna and Dr. Maggie, but we'll do our best to make sure all of them are answered in this session. So just keep your question very clear and concise, and we'll pick it up when it's time for the Q&A. We'd like to encourage you as well, before I introduce the panelists, to make sure that you put the hashtag and the handle when you're tweeting. So the handles are Future Afri Forum, that's at Future Afri Forum, and of course at Pandemic Action. Those are the two conveners of this session, so we'd like to appreciate them and make sure that they're mentioned so that they follow the conversation as much as possible. The hashtag is Africa Pandemic Resilience. So please feel free to write as much as possible as you'd like, also on social media, tagging those two organizations. Perfect. Let's jump into our next session. When I mention your name, please put your video on, but don't put it on before, just for the element of just surprise and to dramatize the whole process. The next panel discussion is on enhancing Africa's pandemic preparedness and the response ecosystem. So here we'll be touching on disease surveillance. We'll also touch on lessons from the past epidemics and maybe things like low vaccine uptake and what we're doing with that. We'll talk about regulation and the regulatory body, what exactly they're doing, even in terms of harmonization. And we will also speak more about regional coordination and funding for global health. To take us through that one by one, Noella Bigirimana, please put your video on. That is the Deputy Director General at the Rwanda Biomedical Center, a national health implementation agency in Rwanda. Prior to this, she served as Division Manager of Research, Innovation and Data Center at the Biomedical Center. She has also served as a government fellow at the World Economic Forum. Noella, thank you very much for joining us. Next up, we have Dr. Ebere, whom we've heard from. Dr. Ebere Okereke is a Senior Technical Advisor with the Tony Blair Institute, that's TBI, for Global Change, and an Honorary Senior Public Health Advisor to Africa's CDC. She is currently co-leading Africa CDC's partnerships for African vaccine manufacturing, as we've heard. And prior to this, she has won awards for her work promoting women and underrepresented groups in public health leadership. So Dr. Ebere, thank you very much for joining us as well. Next up, we have Professor Francisca Mutapi, who is a professor in global health infection and immunity and co-director of the Global Health Academy at the University of Edinburgh and deputy director of the NIHR Global Health Research Unit tackling infections to benefit Africa. She's also an internationally recognized visual artist and a 2021 TED Fellow. So a creative and a professor as well. Thank you very much for joining us. And finally, we have Dr. Sidibe, who's with the AU Special Envoy, who's the AU Special Envoy for the Africa Medicines Authority, that's the AMA. Prior to this, he served as Minister of Health and Social Affairs for Mali, and as Executive Director of UNAIDS, holding the rank of Under Secretary General of the United Nations between 2009 and 2019. So a good decade under that docket. Further to this, he has served with UNICEF and Terre de Home, where his passion for advancing global health and social justice began. So the four of them are our panelists, and we'll just jump straight into the conversation. Of course, as we said, we're tight on time. So panelists, please keep your questions precise and concise. And to anyone listening, please put your question in the chat box and we'll pick them as they come. Let's start off with Noella. Disease surveillance is something that has been noted as one of Rwanda's strongest key points. We noted it with how they managed COVID with the Basketball Africa League and most of the conferences that have been set up in the country. So we do know that has happened, and we'd like to know how exactly you've managed it and how it's evolving. So as a tourism or conference hub, you've made disease surveillance a priority. What are the best practices that can be shared?
Well, thank you. Thank you, Georgie, and happy to see everyone on the panel. I think I would start, in the context of Rwanda by emphasizing the need for urgency. So when we are planning, and here I speak on behalf of the Rwanda Biomedical Center, but also since we are under the Ministry of Health oversight. So my perspective is from a national public health institution. So as we just heard from Dr. Fiona, this type of institution has a key role within the context of a country. So what we've been doing in terms of surveillance was actually built from several years of building our preparedness in terms of outbreak and preventing outbreaks, as well as having urgent responses. So as we speak right now, let's remember the context, right? The health authorities in the DRC just declared an outbreak of Ebola on Saturday. And so far, there's at least 2 cases that have been confirmed. And I think sometimes we forget that these outbreaks, and there's also yellow fever and Rift Valley fever, in addition to the pandemic, have shown us that the pandemic preparedness is actually a global public good. And this benefits our country. Not one country can actually, alone build this capacity. What we know and what we've done in Rwanda and the tools that work is the early detection. It's also the prevention and rapidly and effective response. It means that there has to be access to the vaccine, there has to be access to the medicine, as well as diagnostics, and a robust non-pharmaceutical intervention. Another thing that we've done in Rwanda, and this is the response that started in the COVID, for the COVID pandemic, our response started in early January. And this is at the time where the WHO had just declared the COVID as a public health event of international concern. And at the time, this is pre-pandemic. And so what we did is go to the points of entry and start to do the screening. Again, this is built on the Ebola preparedness that had been in place for several years. When you think of diagnostics and our lab capacity, this had been built over the years and was strengthened through the way we responded to the pandemic. So as we established ourselves as a conference hub, it means that we were receiving and continue to receive people and delegates from all over the world. It means that this surveillance, the early detection, the strong diagnostics, and the overall public health response has had to remain quite robust. So I think to your question about the lessons, many of them have been mentioned. So as I highlighted these tools that work, the fact that you have to keep strengthening public health capabilities over the years and not wait for a pandemic or wait for an outbreak that has a potential to turn into a pandemic. You have to be building these capacities over time. There's also the strengthening of and support of a regional response. As I was mentioning, the response has to be beyond one country because we are all interconnected. And we also talked about regional manufacturing, and it's a place where Rwanda is really building. And so you've heard of the focus on vaccine manufacturing, specifically on the mRNA technology, but truly it's part of a broader strengthening of manufacturing. And it's not the country of Rwanda, it's actually a hub that is established in Rwanda, but really serving the continent. And that's been really the approach here. So a strong leadership as well that provides a clarity in action and strong commitment. I think these are the things that I would highlight to get the dialogue started, and very eager to hear comments and questions. Yeah. Thank you.
Perfect. That definitely kicks off the conversation. Thank you very much, Noella. We'll throw it now straight to Professor Francisca. We've heard about Ebola, and we know what's happened over the weekend, as Noella mentioned. The 2014 to 2016 Ebola outbreak showed us the need for more multi-sector engagement and collaboration. 2 years later, it still feels like COVID caught us off guard. And if that's not case enough, we still have the Ebola case that was mentioned that also feels like it caught us off guard. What are your thoughts on this?
So thank you very much. I think to start off, it's really good to remember that Africa has done significantly better in terms of COVID-19 deaths, not necessarily infections, but deaths. So what can we learn from that, both for Africa and for the rest of the world? And that's really important because it gives us something to build on in terms of working together with the different sectors. Even a good thing can always be improved. So what does Africa do differently? How can we bring those different sectors together? We have community-based healthcare, which is almost unique in Africa. We need our local financing, we've heard that. That will allow our health infrastructure to work with our health workers. And we need, of course, the governance. We've also realized that you can have a lot of products, but if you don't have the governance and the regulatory teams behind you to ensure that things get from A to B, you cannot get very far. We have looked at an analysis of the COVID-19 pandemic in Africa. We've talked a little bit today about preparedness. And one of the things that's been very interesting has been the equating lack of vulnerability to preparedness, which are completely different things. When we look at countries that did very well in terms of all the indicators of preparedness, so that's the Infectious Disease Resilience Index and COVID-19 readiness. In Africa and in the rest of the world, countries that scored very well in those indices are the ones that were hardest hit by COVID-19. And that tells you that preparedness is not the same thing as vulnerability. So going forward, it is really important for Africa to be engaging with the different sectors to reduce our vulnerability while we're also building on the pandemic preparedness so that we have this nuanced approach that looks at Africa's strengths and builds on those across the sector to ensure that we do not lose what Africa does best in our attempts to copy what other countries are doing in order to improve their preparedness. I'll stop there, thank you.
It's a perfect segue. I can see the questions starting to come in, so thank you very much, Professor. Dr. Sidibe, we've had now some of the foundation being said. Noella has mentioned, and of course, Professor Francisca has mentioned as well. As good a job as the African Medicines Agency is doing, and you particularly as the AU Special Envoy, we still have some pain in our necks when it comes to every time we open the news, we see something about mistrust, disinformation around vaccines, uptake, people dying, diagnostics, Africa being, the butt of jokes from maybe different global players. How can we move now into a more effective, efficient, and trusted regional regulatory body, knowing very well that we are working towards common good? Dr. Sidibe? You're muted. There we go.
Is this okay?
Very
I was just saying thank you for inviting me to join great panelists for this important and timely discussion. It is timely because, in fact, all of them mention that we need to change the paradigm, that the main issues today is that we cannot do business as usual. In fact, you're right. The COVID-19 pandemic has exposed our continent's vulnerabilities in ensuring access to vital drugs. You mentioned different panelists mentioned not only drugs, vaccine and health technologies. So we face, during this period, I can say, huge bottlenecks. And we need to learn from that one. Lack of visibility. I was traveling in most of the countries. Lack of visibility on supply, the timing, the volume and type of vaccine. We were faced with a major problem in most of the countries. That was not enabling us to anticipate and to plan implementation and even develop policies and curb pandemics. So instead, we were obliged to rely on donation, different vaccines, short shelf lives, and no continuous supplies in some cases. So it's very important to take time and to understand those complications were creating inequities. And it was showing clearly the failure of global health to develop hand-to-hand infrastructure, including manufacturing of medicine, vaccines, and health products in the continent. I think we were faced with a weak negotiating mechanism, loans, regulatory system, which could really help us to say that we are not just linked to global regulatory bodies, that we have our own regulatory system, and will not be just hearing today that AstraZeneca is very good for you, but tomorrow is not good. But after tomorrow, when you're coming in Europe, you cannot enter with AstraZeneca because it is not produced in Oxford, it's produced in India. So it created a huge hesitancy, and it created a problem with a confidence building for people who were keen to come to take a vaccine. So this weak negotiating mechanism, which were not existing, loans, manufacturing, prioritizing high-income countries, payment methods, and reduce risk for manufacturers. I think all of that we have to internalize. Unfortunately, we have to recognize that as long as we rely on high-income countries' manufacturers, we will always be in second line. I experienced that with HIV. Years back, we waited 7 years when I was fighting to make sure that we can make those drugs available to poor citizens in our continent. We waited 7 years. So I think what I want to say here is very important that we rethink our models. We cannot just continue to think that by producing less than 1% of the vaccine that we consume, that we will be resilient for a long time and build a system which will be able to really face next pandemic. You were mentioning that. Now we are importing over 99%, despite this continent is consuming 25% of the vaccine globally. So we realize one thing, which is very important, and I think my sister Ekere was talking about, is this limited size of pharmaceutical industry is partly driven by regulatory system weaknesses, including unclear regulatory policies, inefficient regulatory procedures and processes, and limited capabilities on general regulatory topics, which is taking a lot of time for introducing only one new molecules in the continent. It can take 4 to 5 years. So a strong regulatory system is an integral part of well-functioning health ecosystem, Georgie. And the pandemic is confirming the urgent need for the African Medicine Agency. It will help us catalyzing the transformation of African regulatory system it will require a coordinated effort at national and continental levels. AMA stands, African Medicine Agency, stands to contribute to the protection and promotion of public health in Africa. In doing so, AMA would contribute to enhance global health security like mentioned before.
Right.
So I want to just say that we need really to develop best-in-class national regulatory authorities, and that is very key. It is not just about global continental, but all our national authorities need to be strengthened. I will stop there and I can come back later on.
Perfect. I'm sure there's also a lot of questions. Someone said, Dr. Sidibe speaks my mind. So we're definitely resonating with what you're saying. Dr. Berry, we wouldn't want to lose that momentum. There's something that was mentioned. Of course, we knew this statistic, but we waited 7 years to make the drugs, HIV drugs, available. And it always feels like Africa is playing catch up, right? Playing catch up, playing catch up, playing catch up. We have all these global bodies that review and come up with various recommendations for strengthening global health security, and they factor in all the feedback from different continents and different governments. Have African voices meaningfully informed these recommendations? Maybe you could tell us what's lacking on that side and what we need to do to push a bit more to just be heard.
Okay. Thank you very much. And again, thank you for the opportunity to be on this panel with global health professionals and leaders that I admire hugely. I'm going to step back a little to answer that question, because I think it's important to look at the context within which the global health functions. We need to remember that public health is politics. You don't make changes on population level without a political imperative. So currently, there's all the buzz about new pandemic treaties, and I'd like to pour a little bit of cold water on that to say it's all we're at risk of distraction by focusing on a new pandemic treaty when the one we currently have, the international health regulations, we haven't optimally adhered to it in the current pandemic and in past pandemics. We've had treaties for 150 years, and what we need to understand is that in peacetime, when things are going good, though the nation states do tend to think about global health as individuals around the globe, wherever they are, being equally entitled to the best that the system can offer. Under pressure, we change. Under pressure, nationalism becomes the priority. We start to focus on our own citizens, and we start to see health security in terms of our own national borders. And that informs how we then act, treaty or no treaty. So the international health regulations were very clear about what we should do to prepare for a pandemic. In peacetime and during a period when most of the affluent countries in the global north looked at pandemics as things that happened to the poor people in Africa and Asia, there was a lot of benevolence in supporting African and Asian countries to build up their capacity, prioritizing the things that interested them. That is fine. It's their money. If so long as they're driving the investment, they have a say. But once the pandemic actually affects them, all those rules about we don't put travel bans, we don't restrict exports were ignored, and vaccines were accumulated, stockpiled beyond their needs. There was very much a nationalistic focus. That is humanity, and that is the politics that we engage in. So what we need to do as Africans is to be part of that dialogue, to be an effective part of that dialogue. We can't just be at the end of the line with a cop out asking for what is currently the situation. 20% at least of our health system investment comes from aid. That is not reasonable. Munas mentioned at the beginning, it's 21 years since the Abuja Declaration. Only 2 countries at any one point managed to reach that 15% of budgetary allocation for health. We have got to stop seeing health as an expenditure and start seeing it as an investment. Look at what happened because of this pandemic. Economies ground to a halt. The entire world ground to a halt. Development has reversed. Schools, students have lost 2 years of education. So we've got to start investing in health, and our governments have got to step up and be part of that investment, our private sector. One good thing that has come out of COVID, we have seen the private sector engage in delivering a public health solution. Laboratory capacity has expanded in private sector. Delivery of vaccine is moving into private sector. Let's harness that momentum. But we as citizens have got to hold our governments account and say, our health is our priority, we invest in it. And then if we do that, and that includes investing in health technologies, manufacturing, diagnostics, pharmaceuticals, the whole work, then we are credible and we have a space on the table. Then the other thing we need to do, which we are beginning to do, is to coordinate. The more you coordinate, the bigger your voice. Africa CDC has given us that opportunity to have a coordinated voice for the continent in emerging public health emergencies. That's great. But for that voice to be credible and to be informed and nuanced, we also need, as Noala said, the capacity at state level. We need to have our national public health institutions. We need to have what one of my public health lecturers used to call a clear line of sight, from the front line in the most remote village to the center. If we have that system in place, which we must invest in ourselves through government, through philanthropists, through private sector investment, then we have credibility. And we have none of this argument now about Africa didn't do as well as it looks because they didn't have the data. There is some of that is in the reality, but if we had the system, if we had the data, we have a much more credible voice, and then we ask for a table. We don't ask, we demand a place in those public global health institutions that make the decisions. And we also, as Dr. Sidibe said, create our own, make our own decisions at our regional level. We don't have to wait until somebody in New York, in London, or in Geneva tells us that our house is on fire before we act. We can see when our house is on fire and then have our own coordinating mechanism for responding. So there's a lot we can do. And there is a lot we can do even with limited resources. As this pandemic has shown, having a lot of money and having a lot of investment in your health system does not necessarily make you an effective responder in emergency. We can do better with what we have. I'll pause there. I could go on, but I'll pause there.
Perfect. Absolutely perfect. We cannot agree even more. I can see some chats coming in. A lot of questions to the panelists. We'll just come straight to you, Dr. Ebere, because we don't want to lose that train of thought in regards to the funding. There's a question by Grace Mugabekazi that says, well, you mentioned it. You said, we're not asking for a seat at the table. We're demanding to be part of the table, particularly because Africa is also a frontier market for healthcare tech and pharma. A lot of testing happens here, given our market. So what is a vision to turn around dependency on importation? We can't completely wean off of it, and we need to get to a very realistic compromise. What is required in terms of cash and other mechanisms to change the landscape within the next decade or so?
Well, for vaccine manufacturing specifically, the AU, through the Partnership for African Vaccine Manufacturing, has set a target to say that they want to increase domestic manufacturing on the continent from the current 1% to 60% by 2040. Our estimate is that across the piece for the next 20 years, that could cost anything between 30 to 40 billion US dollars. Over 20 years. So let's not panic. We're not looking for Elon Musk type of money in one swell, in one sweep. But that is just part of it. And how we get that money, a lot of it has got to be government, public sector commitment. Vaccines are generally delivered through coordinated mechanisms that involve governments. And then we have full procurement mechanisms such as Gavi and all that. For vaccine manufacturing to be viable, you've got to demonstrate that there's a market. There's been some questions about the situation with the manufacturing in South Africa at the moment and not buying. That is a situation we need to address. That means you need to work as coordinate, you need to pool the resources that you have, then you need to then purchase in bulk. That gives guarantees to manufacturers to move forward. So the money has got to come from a combination of aid, from investment from the private sector and from public sector. As we're growing a new industry in a situation when there are big competitions from China and India and the rest of the world, we as governments need to say there is a health security dividend here that we need to invest in. So we should be contributing to developing this manufacturing system. It also applies to diagnostics. It is appalling. We have the largest pool of HIV cases in the world, and we don't produce diagnostic tests for HIV. So it applies to diagnostic tests, to all the other essential health technologies. There is a health security dividend that we should invest in. You're mute.
You wowed me. Even the tech, I've forgotten most of the tech. Noella, thank you very much, Dr. Ebere. Noella, now over to come to you, a question that a lot of us have been asking, but we don't really get to the answer of it. You alluded to a very strong governing system and governance in Rwanda, which we have seen from all the way from top down. But what mechanisms or processes, this is a question from Professor Aaron Demir, what mechanisms or processes has Rwanda put in place to diffuse technology or digital innovations at such speed? That is the question that we have. We see a lot of countries come up with the idea, come up with the thought, but infusing actual R&D, actual innovations, and making them practical within the population at such speed. How is that being done? And what can we, just let us know how that's being done.
Mm-hmm. Thank you. And thank you to Professor Emir. I think when you just said it, right? In terms of the governance, one of the things that we've done over the years, one of the things that we've realized is that the healthcare sector has been great at the uptake in terms of innovation, whether it's digital, whether it's R&D based. But it starts. I want to take from what Dr. Ebere just mentioned around the clear line of sight, right? So from the community level, from the community health workers, that in itself is an innovation. It's not just in Rwanda, it's been also piloted in other countries. But what Rwanda did is, once this approach was proven to be effective, it was able to be scaled quite quickly to the point where we have more than 70,000 community health workers in the country. So you go up across the healthcare sector up to the central level, where we are actually looking at the data, when our expertise is really focused on finding what works and then scaling it. So another part that has been quite important, and we've seen it, whether it's in the funding or in the way we approach the introduction of these new pilots, is that not avoiding creation of silos, right? So we don't just pilot an intervention and let it sit there. We try to remain, to connect these different interventions. So what you'll find is one intervention is building on a different one or a previous one that's already in place. And everything obviously has to be based on the need, right? You don't just introduce an intervention that's not, I guess, answering a specific need. So these are some of the top of mind aspects that come, but, and I don't want it to make as though we have it all cleared up, but this has, as a really a key part has come because health has remained a priority in the country. And you're able to see that in the funding, you're able to see that in the type of guidance and the type of uptake of innovation that we have. So I guess I'll stop there, but those are some of the top of mind aspects that are able to show why Rwanda has been good at uptakes and why Rwanda is able to move into mRNA technology, into drones technology, into digital health, and into innovation at the community level, such as community health workers. Thank you.
Perfect. I think that definitely gives us some insight on what we might not know about Rwanda managing most of these scenarios. Let's move on to another question. A lot of the questions came in, Dr. Sidibe, when you were speaking, and we'd like to throw them to you. One said, how do we go beyond fill and finish, to build the capabilities that you described? We build regionally, so the burden is not on individual countries. Let me tie that with another question. Joyce Bitutu said, it's the same case in Kenya, for example, 70% importation, 30% local manufacturing, then the local regulatory process is tough, even for any R&D. So how do governments push these numbers, even with economic strain? So let's touch that, going beyond fill and finish and pushing these numbers up, even with the strains that we have nation to nation.
Thank you very much. I think it is a very important issue. Ebere was touching to some of them. What we need to really certainly put in place is a continental vision. It's impossible for us to go for country, one country after another, producing drugs or vaccine and thinking that we will be competitive and will be able to produce quality drugs, which will help us to take over in this big market. Because it is not just about health. What I want to say here, it is economic issue. Because last year only, the market of drugs was $1,412 billion. And Africa, out of that, was only $1.2 billion. So it is a huge economic issue. So if we want to address that, we need to be strategic. To be strategic means what? First, we need to have a hub of excellencies. We cannot think that we will be able tomorrow to have that in different 45 or 44 countries producing a different type of drugs and others. We need to have hub of excellencies. It's not just drug, it's not just vaccine. You heard every day, it is certainly therapeutics, it's different type of products which COVID show us clearly that we will need to produce. That's one. Two, it's very important to Africanize the research and development. Today, we are too dependent to research and development from abroad. So it's impossible for you to have an independent system which will work and which will really be able to service your population if we don't Africanize research and development. That is a second issue. Third, it's very important for us to engage more strategically the private sector. When I said private sector, the private sector from the continent. We have a huge private sector which is untapped today. It's important to bring them close in this debate of local production. But we need also to have a strong, and I said strong continental public health institution who are critical, I think, to harmonize and coordinate the public health response across the sector, disciplines, and border. Because today, you have almost 40% of some drugs which are fake or substandard drugs. So how you will be able to produce, and if you have 40% of the drugs which are fake, substandard, which is not. And lastly, I think market shaping is critical. You look at what Nwala was saying rightly. Rwanda is pushing, making sure that, but if we produce a vaccine and we don't have a support, it could be a global health fund I was talking about for a long time, to make sure that we can buy our vaccine like Gavi or Gavi coming in and making sure that they can buy the vaccine produced by Rwanda to make sure that it could be on priority line and distributed to our respective other countries who are not producing. If not, we'll continue to fill and how you said it, and just have a product coming and filling and sharing that one. That is not what I am proposing. I think is a strong Africanization of research and development, strong analysis of our market, market shaping, engaging private sector, having a policies which are conducive for helping to make sure that those products which are produced today in Africa could be distributed to our citizens. But also, one point you mentioned, we need to engage better our Minister of Finance. They are too at the margin of the whole debate. And these issues, you will never change it if you continue to be just perceived as an expenditure. It is an investment. We saw that the numbers of, loss our GDP due to those pandemic, we need to consider that. And we cannot continue to have 40% of our population paying for their health and becoming poor and poor when we know that out of pocket is not sustainable. Is possible, is important, but is not sustainable.
That's the perfect analysis and also perfect segue for what we're talking about next. You mentioned something very crucial. The Ministry of Health cannot work separately from the Ministry of Finance because it's an investment. Same way, if you have digital innovation for a farm, the Ministry of Agriculture cannot work separately from the Ministry of ICT. So all of this are very crucial and crucially interlinked. The final question now, as we wrap up, because we're out of time, Professor Francisca, we'd like to hear this from someone watching as well and watching all these players and the government do this. The last question, the last point that was made, how effective and transparent are these investments? In the chat box, we have, of course, we have a case study about Nigeria and what's happening there, but we need strong accountability mechanisms in place. The person says, Musa Mohammed says, more money for health, but more health for our money. So as someone looking in and with the work that you've done, how transparent and effective and how do we build strong accountability mechanisms?
Thank you. So yes, we do need more accountability. I mean, this is a well-known thing across Africa. One of our challenges is taking a vertical approach. If we are going to get more for our money, we need to be looking at a systems approach. Let us not pretend that Africa's health systems were perfectly all right until COVID came along. Let us not pretend that we are shocked to discover that we have low vaccine uptake for COVID, as if we had high vaccine uptake for everything else. I was looking at childhood vaccination uptake in Africa today. There are countries in Africa where it's as low as 24%. We have countries in Africa where the COVID-19 vaccine uptake is higher than in Europe. It's 70% in countries like Mauritius, which is higher than in the UK and higher than in Switzerland. So those countries did not all of a sudden find out they could roll out COVID vaccine miraculously. They have had strong health systems within which to do that. So if we're going to be accountable, if we're going to have better value for whatever we put into the system, we have to look at the health system. We have to deal with problems we have been dealing with before to ensure that we are building on something, not reinventing the wheel, trying to fit it on a wagon that is going nowhere. And so I will stop on that bit and thank you for that.
Right, Dr. Ebere, I'm sure you want to say something on the accountability bit, huh?
Oh, yes, we haven't got enough time. I have to agree with Professor Francisca. It's about systems. Yeah. We have, and again, you can't detach this from my earlier point about who pays. If we rely on foreign countries to invest in our health system, they pick their priorities. If we drive the strategy and say, this is what we need, we have a system-wide approach. We still need aid, we still need support, but we have our own strategic system-wide vision that connects so that we don't have a vertical program for malaria, a vertical program for TB, a vertical program for HIV. It is not efficient. If we have a system-wide approach, and that has got to be driven by us, by our governments, by our national public health institutions, we need more of those, then we can actually optimize the impact of the resources we have. That has got to be where we start. And that is why I appeal to African citizens to say, your political leaders are your servants. You elect them. If they have a manifesto for election and they don't mention health, hold them to account. We need to see health as an investment, as a priority. In the UK, you cannot win an election if you don't talk about the National Health Service. Yeah, so we need to have that same argument in our continent, system-wide approach. And then we then need to sort of recognize that it is on the existing system, like Noella said, that we build the epidemic response. Yeah. If we don't get vaccinations to children, our routine vaccinations anyway, we're not going to get COVID. We don't have, most African countries have never had an adult vaccination program. That's why vaccinating for COVID is a challenge. And there's a question in the chat about vaccine hesitancy and why we're throwing money after this one. Vaccine hesitancy is a complex issue. But fundamental to it is a trust in the health system. And trust in the health system depends on quality and access. If you can get to the health system and you believe it's a good quality, like Dr. Sidibe said, that the drugs are kosher, then you trust it. And then you're more likely to take up a vaccination. Hesitancy currently linked to COVID was also linked to the fact that initially there was a lot of interest in getting vaccinated, then the vaccines never came. And so people thought, oh, well then, so why bother? But if you have a system that delivers in peacetime, that people trust, that is accessible and is of a good quality, whatever you need to bring in response to an emergency has a foundation and a platform to jump off from. And that is our biggest challenge. I'll come back. Health system, politics, then the money, because the money follows the politics.
This should have been a 2-day summit, so we can just have everyone deliberate for 3 hours each so we can get to the root of the problem. So, but we can't appreciate you enough. Noella Bijirimana, Dr. Bere, Dr. Sidibe, Professor Francisca, we really appreciate your time. We can't thank you enough. Thank you, thank you, thank you very much. And to everyone that asked the questions, of course, we got to the heat of the matter. We can't solve it all in one sitting, but that definitely points us in the right direction. So thank you very much. Now to everyone who asked questions, thank you as well. And as promised, the policy brief has been made available. So all of you can download from the Future Africa Forum website and you can access the link in the chat. The same place you are putting in the questions is the same place you can access the link. The Future Africa Forum, the organizers put the link just a few minutes earlier. I can see the next speaker, the face has popped up. So for the rest of you, it's okay. We can switch off and then we'll carry on to the next session. So thank you very much.
Thank you very much. Great
we appreciate it very much. Thank you. Perfect. So Leslie Ndovu, Mr. Leslie Ndovu is the CEO of African Risk Capacity. You can see his face there, but I'll give you a proper introduction to who he is. He's currently the CEO of the African Risk Capacity, or ARC, or ARC Limited. ARC Limited is a specialist insurance company that provides parametric insurance coverage to African countries against extreme weather events and natural disasters. He's spent close to a decade in various senior management roles in insurance and asset management with the AXA Group and Lloyd's of London Insurance Syndicate. Now, you might be wondering, how exactly does this tie into this conversation on preparedness and whatnot? So, Mr. Leslie, I think it's up to us now to give enough context as possible. We still have very rigid financiers, and then now this whole pandemic came up. Health is a big issue, mobilizing health, existing financial systems are weak. Speak to us about this diversification versus the existing financial systems. Give us context.
Thank you very much, Georgie. Good afternoon, everyone. So really to set the stage, as my fellow panelists have already mentioned, when there is a pandemic such as the one that we have experienced, the ability to act very quickly is key to reducing the impact of the pandemic. Intervening in the course of a pandemic comes at a very high cost. And what we find across Africa is that governments do not necessarily have the liquidity that's required to be able to respond quickly and effectively. The best illustration of this is the outbreak of Ebola that happened in Guinea in 2015, which was originally identified in one small village. It is estimated that the cost of containing Ebola within that one village would have been in the region of $5 million. But then the government did not have the funding to be able to quickly respond. And as a result, Ebola spread to 14 African countries and caused billions of dollars in damage. So the way we come at the problem on the insurance side is to create financial mechanisms that very quickly provide financing whenever there is a pandemic of this sort, which fits in the realm of natural disasters, which we cover within the African risk capacity. So we are a specialized agency of the African Union, but we have a commercial insurance arm, and we have been working on creating a solution, an insurance solution, targeting the most common pathogens in Africa. So Ebola, as I've already mentioned, meningitis, Lassa fever, and of course, COVID is still live, but we are looking at it as well. And again, to emphasize, we want to have a mechanism that allows quick access to quick financing at the level of governments to facilitate early response and prevent what is a dangerous situation from becoming infinitely worse.
So maybe just for clarity's sake, so who can access the money that you're putting up? Is it governments? Is it private companies? Is it a mix of both? Just make it very clear for us. I, as a country, have a particular issue, or I'm a private company within a certain country. How do I access ARC's money?
So then ARC operates through an insurance contract, which is signed at the level of the government, because we want money to be available for response at the level of the government. In very simple terms, we enter into an insurance contract where we agree to pay to the government a certain amount of money in the case of a pandemic. And when that pandemic happens, then the government has access to financing. It is very similar to how health insurance would work for you at the individual level, where you pay on a monthly basis or on an annual basis premiums to an insurance company. And then whenever you need to access healthcare, that cost of healthcare is borne by the insurance company and not by you. And in so doing, you have transferred the risk of illness from yourself to the insurance company. And we are doing this on an Africa-wide basis for governments, which allows us to then have a diversified pool across all the various African countries.
Okay, so that's perfect. That's very clear. Let's talk about something else. In regards to private capital deals, the total value of private capital deals in Africa reached a record high last year. That's over $7 billion. Translating this on ground is not as visible to anyone without further insight on what the private capital deals are, but paint us a picture on the state of private equities and their role of financing in Africa. How effective is it? And is most of the money staying within the continent?
Yeah, that's another great question. So then we have started that discussion by framing it in terms of public health, which is the best place to start from, because in Africa, more than in other countries, the government still plays an outsized role in terms of health. However, the scale of the problem that we face is such that we cannot rely on the government alone. There has to be a crowding in of private sector capital. So as you've just described, the fact that we reached the record levels last year is a significant milestone in its own regard, because the ultimate solution is to have the complementary interventions of the government and of the private sector. If you look at the way health is structured in other countries, you have a private health market which targets maybe the more affluent citizens, and you've got a public health market which targets the bottom of the pyramid, which allows the government to be able to prioritize its own spending and allow those that can already afford healthcare for themselves to pay it through the various insurance schemes. So from the way I look at it, the various mechanisms do not compete with each other. They're in fact complementary to each other, and the inclusion of the private sector is necessary to improving healthcare outcomes more broadly across Africa.
Final question. Let me ask you one final question, and then we'll probably wrap it up, Leslie. But very interesting so far. So let's give one example. One of the biggest funds in the region currently is a green fund, right? So that deals with unforeseen risk, natural disasters, you name it, dealing with things, climate, you name it, right? And that's one source of funding that also taps into making sure that governments are not strained, and when there's a health issue, they have enough money or enough resources to handle it. The problem with such a fund like the Green Fund is that awareness and understanding of it is still a huge issue faced by very many requirements, and anyone investing has very many risks. How do we reduce the challenges with such offerings? Because I know Africa has a lot of money being thrown at it, but most of the time we don't understand. So when we are financing health, we're financing deeply within our pockets. Talk to us about this.
Yeah, and another fantastic question. So the way I approach this is to just break it down into its constituent elements. At the national level, the starting point should be reflection of on a national holistic approach, because the government, as I mentioned earlier, has the widest reach of any entity in the country. So there has to be planning at that level in terms of what problem do we want to solve, how are we going about solving it, and what role all the various players can play in that. And then once this architecture is clearly outlined, then you can see where the various pieces fit in. So you gave the example of the Green Climate Fund. So as it relates to climate change, you can think about adaptation, you can think about mitigation, and this requires a high degree of coordination, because in some instances, you have some activities that are carried out by the Ministry of Finance, by the Ministry of the Interior, by the Ministry of the Environment. So there has to be this high level of coordination that is required. Of course, I agree with the sentiment that sometimes all these global pots of money that have been made available are onerous to access, requiring cumbersome documentation. In some cases, there's overlap and there's duplication. But as was said by the earlier panelists, for us on the African continent, we shouldn't just be reliant on donor funding for our priorities, because the donors fund things that are important to them. So we should, quoting what one of the speakers said, be demanding our seats at the table, but also making a substantial contribution to the solution, not just in terms of rhetoric, but in terms of our own money, so that it's not the donors driving the agenda, but it's the donors creating the fiscal space for us to be able to achieve our own objectives and what is important to us as Africans.
Yes, there is a crucial point that has been raised. Musa Mohammed says in the chat, you're right, the simpler the better. If the requirements are cumbersome and hard and vague, the risk is there will be no access. Valid? Is that a valid point?
Yes, absolutely. And then even when you look at these global pots of money that have been made available, they've had a challenge with disbursement, especially timely disbursement for exactly those reasons. So I completely agree with the sentiment that the simpler we can make things, then the better the outcomes are going to be.
Perfect. I can't appreciate you enough as well. Just like the other panelists, you've definitely given us enough context and a lot to chew on as we continue with this conversation on preparedness and resilience. So thank you very much, Leslie.
Thank you.
We appreciate you very much. Just enjoy the rest of your day. Thank you. Thank you very much. Let's just move on now to the last speaker of the day. Thank you to everyone who's stayed on. We're just about 5 to 10 minutes away from finishing everything. The next person we're about to call, who will touch now on the way forward. Most of the time when we have these sessions, we hear the words, we need to do this, we need to do this, we have to do this, we need to do this. But we need to have a very clear pathway to move forward. Now, to give us reflections from Africa CDC on pandemic preparedness and response and the way forward is Dr. Merawi Aragao. Dr. Merawi serves as acting head of the Emergency Preparedness and Response Division at the Africa CDC. Before joining the AU, he served as advisor to the Minister of Health of Ethiopia on public health emergency management for more than 6 years. So very well placed to have this conversation. He's a medical epidemiologist with years of experience in health systems and public health programs, disease surveillance, like we've had with the case of Noella when Noella was speaking earlier, investigation and management of disasters and outbreaks, and evaluation of surveillance systems. So Dr. Merawi, definitely a pleasure having you here. We'll jump straight into matters on preparedness and establishing a body around it. Among the things and decision points around February this year that African heads of state made was to have better preparedness and better response agenda within the continent. And they mentioned the decision to establish an Africa Preparedness and Response Authority. So let's start from there. The significance of that, which means we have another body managing other bodies that were also managing other bodies and other mandates, whether we hope we'll see an overlap or how clear that is and the significance of something like that to preparedness and response on the continent. Give us your view.
Thank you, Chair. Thank you, Future Africa Forum and the Pandemic Action Network for inviting me in this forum. It's a really very important and timely discussion. Yeah, with regard to that point of decision, I think let me take you a little bit back and before COVID and before that during Ebola and so on. And the continent is really, every year we have about 120 to 150 disease outbreaks reported across the continent. I mean, the health events. Of these, 90% of the time are infectious disease outbreaks. And the remaining are like hydrometeorological events and so on. So when it comes to such a decision point where there is only one mechanism, like a global mechanism where we decide like public health emergency of international concern, that only address when it's a concern for the global public. But when it comes to our region, we were not yet there to decide which one is really more of our own interest that we need to act on immediately. Of course, every event or every health incident is a risk for the rest of the world. But when it comes to our region, we need to have that capacity and capability to decide where, when, and where we can act on with such kind of authoritative decision-making point where you can say, this is public health emergency of continental concern or regional concern that we need to act at this level of a point. What I mean is, what is the level of engagement? What is the grade of that incident that we need to really act on? That should be a kind of mechanism that will tailor our public health actions in emergency. So this decision is really very, very important and significant. In addition to, there were a couple of other decisions that were passed last February. And it is really very important that we take lesson from our pain in this COVID-19. You have seen that the global solidarity has really fallen apart like that. It is because we were finished, we were left helpless during that situation. And we don't want to repeat that mistake again. We are really coming to own our own problem and to be really the subject matter experts of our own issues to act on in the continent. And that is really a significant decision in moving our public health action forward with regard to really health emergencies in the continent.
Right. Maybe just a quick question on the same. So, of course, the pathway to actualize or operationalize this decision point needs a lot of other parties. So how can civil society be involved in the process?
Yeah. This health is not like it's not like a single matter that will be really taken care of by public health or by public authorities or so. It is the whole of society needs to be engaged in public health emergencies, especially in public health emergencies and in public health action in general. So the civil society organizations are everywhere, and they play a crucial role in all our public health actions across the continent in this pandemic and in the previous outbreaks. And they are there in the community, working day in, day out with the communities. They know the culture, the sociology of the community. So this group cannot be really left behind and say that we are doing public health action in that country, in that community. So they are part and parcel of all those decisions. And this is really significant. I think I can't really appreciate them like anything. It's really huge contributions they have been doing, especially with COVID-19 response. And we have practically engaged at the community level, at different levels in the government structure as Africa CDC, and the civil society organizations has played a crucial role in all public health actions, including vaccine rollout. Currently, that is what we are really working together. So community mobilization, community engagement, public health action is not only something that will do it on a paper in the office. It should be done at the community level. The community diagnosis, that like in a clinic when we say patient diagnosis, and there is what we call it in public as community diagnosis. It is well done with civil society organization. Without them, it is meaningless really to say so. So they are really very crucial component of public health in action in the continent.
Right. Thanks for that. Now, very quickly, of course, funding has been discussed, and we need to discuss it for just 1 minute, and then we'll close. So please, you'll keep your answer very precise. We know that there are ongoing efforts to establish a new global fund for pandemic preparedness. What are your thoughts on, one, this fund, and two, whether this will present new challenges or it will support the objectives of the epidemic fund?
All right, thank you very much. I think that's a very important question, and Leslie has given us another option of emergency funding mechanism. So when it comes to this kind of platform where we can benefit from, we need to take into our advantage, and we need to take part of that. And the governance all should come from within out, not like it should be imposed upon us. What I mean is, like it should be country-owned, co-created of projects based on our needs in the continent, and it should be owned and led by the governments from all levels of the government, at the community level, to the national level, regional level, and continental level. So it is an opportunity and a challenge. It will be a challenge if we let it go like that. And if you don't own it and co-create with it, then we'll be finished. I mean, it should be owned, controlled, led, and managed together with the global community. We can't be left behind. And I like that thing that you mentioned, catch up. We can't afford any more catch-up thing. So that is what I mean. It is an opportunity if we use it and act with it together. Thank you.
Thank you very much, Dr. Merawi. We've come to the end of that, but thank you very much for also creating some time to speak to us and give us your insight, of course, from someone within the industry. And we'll definitely keep having these conversations, and all the best with the Africa CDC and what you're doing for the continent. At this point, let's please have all the panelists that we had earlier today just come on and put your video on. We'd like to appreciate you properly. We made it to the end. Was that everyone? Yeah, so Muna, so I'll just appreciate everyone that's here. Muna, thank you very much. Dr. Maggie, Gerald, of course, you're a co-convener, but you were speaking as well. So thank you. Dr. Merawi, thank you. Caroline, thank you as well for the work that Pandemic Action is doing. Noella, we've spoken before on different panels. Every time we always find something new and discover something new, so we appreciate that very much. Professor Francisca, thank you. Dr. Ebere, very heated conversation, so we love it, how the panel managed to just bring out a lot that a lot of people were thinking. So we really do appreciate it. For everyone that's still watching, we have just under 100 participants that were on. We had over 100 earlier. Thank you to everyone that stayed and asked as many questions as possible. So the Future Africa Forum did mention that if you have any questions that have not been answered, you can submit your questions to them and they will make sure that you get the answers to your questions. If there's anything pertinent that you need to be answered, even on the Future Africa Forum Twitter page, Pandemic Action page, just make sure you tag them, DM them, bombard them with all the questions that you have. I think I've absolved myself from this one. So you can ask as many questions as possible and they'll be sure to get them to you. Of course, the policy brief has been made available and it's in the chat, so you can download it from the Future Africa Forum website. So again, to the panelists, thank you very much for your time and insight. My name is George Ndirango. I've been your moderator for the day, and I appreciate you all. So please enjoy the rest of your day, evening, depending on where you're from, your afternoon. Please enjoy and keep up the good work.